Hey there, this is Dr. John back here with another Thursday session of very cleverly titled show called Ask Dr. John. And I'll be here for half an hour or however long I need to be to answer your questions. I have three questions that I'm going to answer today, two very short, and one we'll take a little deeper look into. And so if you have questions that you want to get out, send them to us and we'll see if we can get to them today. All right. If not, hopefully we can get to them next week. Oh, one comment. I get a lot of questions that I can't understand. They're like fragmented sentences, like people expect that I should know what they mean. And like frog dart help, right? It's like, I don't know what that means. And so if you would use complete sentences, or as my wife used to say to my son, use your words. And if you can kind of get that, in complete ideas, it will make it a lot easier for me. Okay, thank you. So one of the questions that we are looking at today came because someone, well, I'll read it to you. I usually see Jenny for acupuncture, but I think I have a question for John and Catherine. After your email, I bought the Sweet Spot book. Very wise. I was going over my blood tests and realized that I have a 60 on the eGFR range, and I understand this could be close to stage 3 kidney function trouble, and wondering what I can do to improve this. Please advise. Thank you. So I'm going to handle that one at more length because it actually is relevant to everybody. I find that most people that are having kidney problems are not told that they're having kidney problems until it gets to a very serious level. And I have theories about why that's done. The bottom line, however, is that it is being done. And if the earlier you catch kidney issues, the better the outcomes. Once they get to a certain point, I don't believe they can really be helped. I know that they can be in ranges that doctors say can't be helped, and we can still help them. But at a certain point, it's just really, really difficult. So that's one question I'm going to look into in a few minutes. And I'm going to do more of a presentation on that. Anything that you want to get out of the book, The Sweet Spot, which is about looking at labs. So what this fella did is he read the book, went back and looked at all of his old labs and said, oh, hey, wait a minute. This one is outside of the range that the book says is ideal. And so he checked in with us. I welcome any of you to do that. And if you say, look, I saw this range in the book and this is my value, do you have any suggestions? Can you tell me why this is a problem and what I can do to fix it? I am happy to take a significant amount of time to handle those questions. Okay, and I'll often put together a little presentation for you. Now, some of the other questions are just real simple, and I'll talk about them. Here's one that says, when is it best to just live with allergies and keep hiking and gardening? Eyes water, but there are good drops. Throat scratches, but as long as one realizes it's just allergy and not thyroid issue, there's tea. Is the balancing point herein? Don't know what that means, but I'm going to answer the first question, which is, when is it best to just live with allergies? Well, it's best when there is no remedy. You just have to live with some things. You break a foot and you get arthritis, and it's going to be arthritis perhaps for the rest of your life, then you just live with it. Same with allergies. Some people have such severe allergies that it's very, very difficult to do anything to fix them. However, do everything that you possibly can to try to fix them. If you look at the research, there's been a lot published over the last few years about the dangers of several drugs that are used to treat allergies. And in all of those cases, they show a higher death rate. Some of them short-term from being drowsy and getting in car wrecks, many of them longer term, and people dying from dementia, because there's a higher risk of dementia from those drugs. And what isn't often published, but which has, there's been a significant amount of research published, is that just having allergies, just that increases your dementia risk. And the reason is really simple. So one of the things that we're experiencing in our culture at this time is an increase in what are called mast cell disorders. And it's become a very popular topic There are summits and classes. Every day I get notifications asking if I want to participate and or watch these presentations. And that's because mast cell disorders have skyrocketed way over where they were 10 years ago. And it's not just a matter of increased diagnostic capacity, it's they have skyrocketed. Some people think it's from the massive amount of electromagnetic frequencies that we're dealing with. Some people think it's from our food supply. Some people, there's a wide range of theories about why it has gotten so much worse. But the bottom line is it has gotten worse. So with a mast cell disorder, the mast cells are the cells that contain the histamine. And when the mast cell is disturbed, so it comes in contact with an allergen, and so it wants to respond to help you deal with the allergen, then the mast cell explodes, and the histamine travels through your system until it gets to the appropriate receptor. And at that point, it will create additional mucus, or it will cause eye tearing or other eye problems, depending on where it lands. Sometimes it will cause eczema and extreme itching, hives, things like that. Those are all caused by excess histamine release. Some of that is normal and ordinary, but a lot of it's from this increase in mast cell disorders. And so that histamine in the system is very heating. From a Chinese standpoint, we'd say it's very hot. From a Western standpoint, it's very inflammatory. And so if you've got that histamine running around in your system, it basically over time fries your brain. Now, if you use an antihistamine, seems like it would be helpful, right? Well, it is helpful for symptoms. I mean, if you have to do something, drive heavy machinery where you actually have to see or something, well, then use the antihistamine, but use it as seldom as possible. So when you use an antihistamine, it doesn't stop the release of histamine. It stops the uptake of histamine at the target cell. So what happens if you have this huge histamine release and you block the uptake, which means the histamine is not being used up, right? Of course, you get more histamine in your system. And that's why the rebound from being on antihistamines is so horrible, because you now have even more histamine in your system because it hasn't been used. You go off antihistamines and you will just explode with allergy symptoms. And that's one of the reasons it's very hard to get off of antihistamines. So then you have this huge histamine buildup in the body, which is even more inflammatory, leads to more dementia, etc. If you can get away without antihistamines, you're way better off. There are ways to sensitize yourself. There are a variety of treatments. There are traditional Chinese medical treatments, and there are Western medical treatments where they will inject a small amount of the substance and work your way up so that you stop being allergic to it. Either way, it takes quite a few treatments. However, it's worth it if you have severe allergies. Or you could take supplements and herbs that are known to reduce allergy symptoms. Catherine put out a newsletter today that I hope you've all seen about some of the substances and about mast cell disorder and histamine disorder and about certain supplements that can help with allergies. Now, we find that in people with mild allergies, our treatments get rid of them. With moderate allergies, we reduce them a lot to the point where people don't feel they need antihistamines. If they're really, really extreme, we knock them down maybe halfway and they can reduce their antihistamines, but they may need to use some. And so right at the core of those treatments is the supplement quercetin, which is an extract of multitude, fruits and vegetables. It's just really, really concentrated. And so it is very, very helpful at controlling those symptoms. Ginger is good. Bromelain is good. Nettles are good. Those are some of the common things that are used, and there are more, and you can find the list in the newsletter that can help reduce these symptoms. And we have herbal formulas that do the same thing. So try doing it yourself. If not, go see someone who naturally treats mast cell disorder by binding the mast cells, not by using antihistamines. And if you have to, use a little antihistamine, but use as little as possible. So I think that handles that. I got another question. It says, how to avoid sepsis if in a hospital? And then this person seems to answer the question themselves. It says, leave quickly? Question mark. Yeah, leave quickly, because the longer you're in the hospital, the greater the chance of developing sepsis. So most hospital-acquired sepsis, and sepsis is an infection, usually bacterial, but can be fungal, that penetrates into the bloodstream or into some body organs and then into the bloodstream. And it's extremely deadly, very, very high death rate. And so if you do need to go into the hospital or someone you know needs to go in, watch the doctor or the nurse and make sure that they are properly cleaning and disinfecting the site of the central line. So they're going to put in a line in the, usually in the elbow, sometimes in the hand, could be in the chest or the groin. And that's so that they can run fluids or medications as needed. Make sure that they're doing that properly, and properly is clean, really clean, because that's one of the most common sources. Now, every day that they stay in the hospital, and every time they have one of those lines changed, or the line stays in longer and longer, it increases the chance of sepsis. Also, catheters, urinary catheters, very commonly will cause infections, and those can also become septic. Now, if you or someone you know is diagnosed with sepsis, there's one thing you have to do above all else. Push for the Marik protocol, M-A-R-I-K. Paul Marik has been around pretty much forever. He's was considered the dean of intensive care medicine in the United States and pretty much in the world. He trained hundreds of doctors until he lost his hospital privileges for wanting to use his protocols for COVID, which reduced the death rate by over 50%. And he wasn't doing anything trippy. It wasn't like doing hydroxychloroquine or ivermectin, et cetera. He was just doing what any good emergency room doctor knows to do, but he was instructed not to, and the death rate was much higher after he was not allowed to do that. But he's published over 800 articles. He, like I said, is the dean of intensive care medicine, and his protocol, it could not be simpler and it could not be safer. And you can look this up anywhere, pretty much online. So he would do intravenous vitamin C at 1.5 grams or more every 6 hours for 4 days or until discharge. Pretty simple. You got a couple dollars worth of vitamin C. He would use hydrocortisone, 50 milligrams every 6 hours for 7 days or until ICU discharge, followed by a 3-day taper, because you want to taper off the hydrocortisone. Now, hydrocortisone is not the same as prednisone. Hydrocortisone is much milder. It more mimics your own body's cortisol in dealing with this problem. So again, very safe. And he would give intravenous thiamine. Thiamine is vitamin B1, an incredibly overlooked vitamin. If someone goes into rehab for alcohol abuse, one of the first things they do is shove a huge amount of thiamine, assuming that they're going to be thiamine deficient, and a huge number of problems arise from that. Beriberi, which, fortunately we don't see a lot of severe beriberi, but there's a lot of subclinical beriberi out there. If you look at the symptoms and you look at the signs, you're going to be shocked. So he did 200 milligrams every 12 hours times 4 days or until hospital discharge. So 3 really, really simple things: vitamin C, hydrocortisone, thiamine. So keep that in mind in case anybody you know ends up in the hospital and needs some ICU care and or develops sepsis. Okay, so I'm going to, and so again, this is a question from the book, The Sweet Spot, and it says, as I mentioned before, that he was concerned because his eGFR was 60. Well, before I did this presentation before this person sent me their labs. We're in one of those interesting situations. Some labs, Kaiser in this region, almost 100% of the time does this, but some other labs, if your value of your eGFR, that's estimated glomerular filtration rate, is over 60, they don't tell you what the number is. If it's under 60, then they give you a number. And that's because 60 is typically considered the tipping point between stage 2 and stage 3 chronic kidney disease. Now, I personally wish they would just give the number, but they don't. And so when I looked at this person's labs, actually, it was saying that they were over 60. We don't know how much over 60, but they did also give creatinine, which is the chemical in the blood that is supposed to be filtered out by the kidneys. And if the kidneys are damaged, it won't filter creatinine well enough. And so the creatinine level is one of the primary things that is used to calculate the glomerular filtration rate. So indeed, he was over 60. We don't know exactly what it was, but it was in a fine range. There was one test where he was probably, looking at his creatinine, probably in the low 60s. If I had seen him then, I would have made some suggestions. But the bottom line is, JM, you're fine. All right, so since I already did the presentation, let's take a look at kidneys though. And I've mentioned this before, the TCM concept of the kidneys. And I bring this up again because if you're going to go to a typical acupuncturist, particularly if they're from China, they will talk about the kidneys a lot. There are kidney pulses, etc. But it doesn't mean what we mean in the West when we talk about the kidneys for the most part. If you look at kidney yin deficiency, basically you'll see a list that looks just like menopause. If you see kidney yang deficiency, you'll see a list that looks like old age and or andropause, which is male cessation of testosterone. And so it can be a little misleading. So in this section, I'm actually going to talk about the concept of the kidneys primarily from a Western standpoint. Once the kidney function is damaged, it's very difficult, and in the minds of many MDs, impossible to repair. Fortunately, this is usually incorrect. Unfortunately, since this is the medical mindset, cures are often not attempted, right? It's just like, hey, dude, you're at this rate, you're at this level, there's nothing you can do, so forget about it, right? Just live happily until you die. And so the eGFR, which is the most comprehensive kidney test that is generally done on a standard lab, is the estimated, the little e, glomerular filtration rate. That means how well are your kidneys filtering out the toxins that need to be eliminated without getting rid of the good things that you need to retain. Now, mostly they're measuring the bad things. And it's the easiest number to track for kidney health. It's one number, and it's very easy to follow. So in the sweet spot, we mentioned that eGFR is one of the very few lab test numbers that's used in a consistent manner. Every lab has different values for almost all tests. eGFR is one of the exceptions. There's an agreed table on those values. Hemoglobin A1C is generally agreed upon, and those values. But for most things, there's not an agreement. They come up with their own numbers. So that makes it easy here because everybody agrees what the problem is. They just don't agree when you should and can treat it. So the lower the eGFR, the worse the kidney health is. They're not filtering waste effectively. Some of the other waste products other than creatinine, and creatinine is a breakdown process of creatine, which is released with muscle breakdown. So, bodybuilders and some people just looking for good health will take creatine as a way to build their muscle health, get big, strong muscles because it's a component. And if someone has done heavy workouts for 1 or more days just before their tests, their lab tests might not be accurate. They might be showing high levels of creatinine just because they worked out really, really hard and have broken down a lot of muscle. So, it bears some secondary looking into. But it also measures ammonia. It measures urea, which are very toxic nitrogen compounds, again, from the breakdown of protein, bilirubin from the breakdown of red blood cells, uric acid from the breakdown of nucleic acids and other sources, and carbon dioxide that happens just from breathing. So those are some of the things that are excreted through the kidneys. This should say some labs do not report a number for low eGFR and drops below 60, which is stage 3A kidney disease. I don't think most people want to be in stage 3 kidney disease. And often, in my experience, patients are not told that they're in grade 3A kidney disease at all. And my only explanation or guess for that is because most doctors don't have treatments for it. So they just don't say anything about it. And I mean, it's not rare. I've seen dozens and dozens of patients bring their labs in and they're in grade 3A chronic kidney disease, or I run their labs and I say, here, take this to your doctor. And the doctor says, yeah, we don't worry about that. Now, I don't like grade 3 kidney disease at all, because if you're at 3A, almost always that's going to become 3B, and almost always that's eventually going to become grade 2. Now, the hard thing about kidney health, now the good thing is this is a really simple, inexpensive test. The difficult thing is most people have zero symptoms of kidney problems, and they get until they get down into grade 2. At grade 1, usually we're looking at getting ready for dialysis. But grade 2, you can start noticing it. But my motto is, why not treat it at grade 2? And again, many of my patients with stage 3A and stage 3B chronic kidney disease have improved their kidney health. So I put this in the book, actually. My own journey to kidney restoration occurred after I had 4 lithotripsies. That's when there's a kidney stone and they lay you on a bed and they pound on your kidneys around 3,000 times. It's like getting punched in the kidneys over and over and over, in the hopes that it breaks down the kidney stone and you can pass it. In my case, I had really stubborn stones that were enormous that I'd had probably 30 years. I remember when they started to develop, I could feel them. And so I needed 4 lithotripsies. And I was on the edge of stage 3B chronic kidney disease with an eGFR in the low 50s. Now, my MD said there's nothing to be done, so I did something. I tend to be that way. I just got my labs back, no kidding. I think it was Tuesday, and my new lab said my eGFR was 80. A good GFR for my age is 75. So I have a supremely good eGFR for my age after being in stage 3B chronic kidney disease. So don't let anybody tell you that you can't fix these things. Because practitioners in different fields know what they know, hopefully. Sometimes they don't, and very often will refuse to look outside of the box of their assumptions. So doctors have generally been told, yeah, you can't fix kidneys, right? You can fix the liver. I have one patient who got a liver transplant from a family member, which they take just a small piece of liver, and they're both doing great because they regrow. That's the cool thing about the liver. Kidney doesn't do that. The kidney's very, very hard and slow to fix. But as you can see here, it is fixable. So they're rare and slow to look outside the box of their assumptions. So if you get a second opinion from someone in the same field, that's great. Just remember, it's not really a second opinion. It's essentially option 1B, because they're mostly looking into the same box. They were trained the same way. So go to someone from a completely different discipline. If you have a chiropractor that looks at labs and understands these things, a naturopath, a functional medical doctor, an acupuncturist who understands these things, go there for your third opinion. It's way too important and it's relatively inexpensive, so get that additional opinion. The kidneys hate acidity. Just remember that. They grumble, they get angry. So stay on the alkaline side of life. And there's several tests that you can run or that are routinely run that can tell you if you're more on the acidic or alkaline side in your bloodstream and in your urine. And so you really want to keep track of that. And uric acid may be the single worst lab test to have elevated. Back in 1892, a Scottish physician named Alexander Haig, not the public or the general, but a doctor, published a book, and I think it went through 7 reprints, where he outlined the dangers of high uric acid. And he said it is a precursor and likely a cause of high blood pressure, diabetes, cardiovascular disease, stroke, obesity, and the list is very, very long. Well, David Perlmutter, who many of you may know of David, he's written a bevy of books, including Grain Brain, Wheat Belly. I don't remember the name of his book for the brain, but he's written a lot. And he just came out with a book called Drop Acid. I love that. And in it, he talks again about the phenomenal dangers of high uric acid. Now, if you have high uric acid, you're essentially burning your blood vessels and you're destroying your kidneys, okay? So it's a test that should always be included. Catherine, how much is uric acid?
$3.
It's $3. It's a $3 test, and it's not on the standard chemistry metabolic panel. It should be on every single metabolic panel. It is so critical. Maybe the most important test on there, outside of the eGFR, I guess. But other significant problems with kidneys are kidney stones, which can be oxalate or urate. They can also be there are other types of stones, but those are the 2 most common. Dehydration. If you eat large amount of meat at one meal, that breaks down and increases your phosphorus level, which increases your phosphoric acid level, which is hard on the kidneys. Maybe the worst single thing for the kidneys are sodas. If they give you that zingy mouthfeel, right? You go to the movies and you get a Coca-Cola and it's like, yeah, like this party in your mouth. That's the phosphoric acid, and that is killing you. High school and college female basketball players that have 1 soda per day has 7 times the rate of bone breakage, as do women that don't do that, because that phosphoric acid has to be buffered. And so your body's going to pull calcium out of your bones to buffer the phosphoric acid, and then you have weak bones. So they bother the kidneys and they bother other things. Simple and inexpensive tests that you should get every year. eGFR, creatinine, BUN are all about your kidneys. CO2 is about your acidity or alkalinity. Sodium and potassium are key electrolytes that you want to track. Phosphorus to see how your kidneys are doing. Hemoglobin A1C for your blood sugars, and uric acid. All together, you're less than $20. All right, so get these regularly. And so you want then also a urine test to look for pH, spillage into the urine of protein or other valuable substances. And in the urine test, you can look for sediment, mucus threads to see if you're developing kidney stones, and you can look for infection. Many people have urinary tracts with infections with no symptoms, particularly if you're over 50. It's very common to have urinary tract infections with no significant symptoms, and it will eat away at the kidneys. Okay, treatment approaches. To create an alkaline environment. Sodium bicarbonate, plain old baking soda. Now, at stage 4 kidney failure, most docs give their patients sodium bicarbonate. I give it to them at stage 3, and I took my eGFR from 50 to 80 in a relatively short period of time. So it's very powerful. Now, if you have high blood pressure or high sodium, you don't want to use sodium bicarbonate because it can pump your blood pressure up. If it's high, you can use potassium carbonate if it's approved by your healthcare provider. Yeah, so most cases, grades 2, 3, and 3B are capable of improvement, particularly 3A and 3B. Here's a list of things: ginger, grape, turmeric. Beetroot juice is fabulous because of the benefits to the vascular system. Stinging nettles, onions, apples, tea, papaya, bitter leaf, guava leaves. By the way, back to our question on allergies, most of these things are also good for allergies. And you're going to see this throughout natural healing. There are a core group, or there is a core group of supplements that help almost everything. Celery seed extract, apple cider vinegar, and a variety of herbs and Chinese herbals can also be helpful. Now, one of the sad things, but it's very purposeful, is many people think that Chinese medicine is folk medicine. There is a folk medicine that preceded what we call traditional Chinese medicine, just as there was a folk medicine that precipitated or preceded Western medicine. There's always a folk medicine, but out of those folk medicines, a great many truths are gathered. Now, Chinese medicine, there are literally 10,000 research studies, well-done research studies done by the same people that are doing the drug studies and the heart studies and statin studies, you name it, same people. 10,000 a year on Chinese herbal medicine. And if you go online and you plug in anything and put in Chinese herbal formulas, you'll be shocked at all the information that shows up. Now, and they have minimal adverse outcomes. And there are a variety of reasons for that I'm not going to go into at this point again. They're very effective. Now, here are a few plants. There are studies out there where you can look up any of these, and these are very, very effective for kidney disease. This is a study that was published, Acupuncture on Renal Function in Patients with Chronic Kidney Disease, a single-blinded, randomized, preliminary controlled study. Those are the authors. Conclusion: acupuncture at these points, which, by the way, are three of the most common points in acupuncture, large intestine 4, stomach 36, and kidney 3, if you don't want to learn the Chinese. When those were done for 12 weeks, it reduced creatinine levels and increased eGFR levels. So this is like as simple as you can get. There are other studies on acupressure for these points. And here is the quote from that study: acupuncture has been proven to reduce urine protein levels and improve estimated GFR. Yeah, what can I tell you? I've seen this for years, and the research is out there. Here's another study: acupuncture application in chronic kidney disease and its potential mechanisms. In patients with chronic kidney disease, acupuncture improves renal function. You notice it doesn't say may, and most studies they'll put in may improve. This doesn't use any weasel words. It improves renal function. It reduces protein in the urine. It controls high blood pressure. It corrects anemia. It relieves pain and controls many hemodialysis-related complications, okay, such as severe itching, insomnia, and fatigue. And the mechanisms are related to the regulation of sympathetic nerve and the activation of bioactive chemicals. All right, so in conclusion, acupuncture works for kidney disease, supplements work for kidney disease, herbal medicine works for kidney disease. So you want to get these tests every year if you're over 40. Again, they're very inexpensive. You want to get them if you're over the price of a dinner out. I mean, if you're going to someplace not very expensive, actually. So these are very inexpensive. Get them every year if you're over 40. And if caught early, it's easy to treat. It's easy. If caught late, it can be impossible to treat. Once you get down into stage 2, very, very difficult to treat. So I want to thank you for showing up here. We will not be here next Thursday. Okay, we will not be here next Thursday. We'll send out a couple of other reminders that we will not be here next Thursday. We will be here the Thursday after that. I have a very important event next Thursday. My granddaughter is graduating from kindergarten, so I'm not going to miss that. But I'll be back here in 2 weeks. Be healthy, be happy, be well. Thank you.